Hello everyone, welcome to my speaking. As a nurse of Transplantation Center, I was interested in how can the readiness for hospital discharge predict post-transplantation outcome. I got answers through this research. First of all, several self-care behaviors are required for a better outcome after liver transplantation, such as medication adherence, infection control, and other behaviors. Also, assessing their readiness before discharge is known to be essential in terms of their safety, satisfaction, and outcome. However, researchers revealed that the medication non-adherence after 1 year of transplantation is a high level. Furthermore, most studies focus on the long-term period and cross-sectional, so the evaluation of adherence at early stage is insufficient. For those reasons, I designed a longitudinal study to investigate the relationship between the readiness for hospital discharge and medication adherence or daily life self-care after discharge. The details of research are conducted following the chart. The readiness was measured using Korean translated version Readiness for Hospital Discharge Scale. It measured the degree of preparation, including personal status, knowledge, coping skills, and expected support. There is no gold standard to evaluate medication adherence. Therefore, both subjective and objective methods were used. As subjective measure, I used the Basel assessment of adherence to immunosuppressive medication scale. It is the most frequently used self-reporting tool to confirm the taking immunosuppressants. As in the objective method, the patient's tacrolimus concentration variability was used with TDM method. We calculated the coefficient of variation using equation as it shows below. The standard point of CV was set as 30%. If it is less than 30%, it means that they are adherent. The self-care behavior measurement scale was used to assess how they effectively care themselves. Moreover, self-efficacy was measured as a general characteristics in this study. We used the SPSS program for statistical analysis. We used mainly the logistic regression and linear mixed model for factor analysis. As a result, 75 recipients participated in this study. 13 recipients refused to participate in midstream of the study, and 2 were died and 4 were dropped out because of the readmission. 56 liver recipients were finally collected. Among the general characteristics, as Table 1 shows, readiness has significant differences according to caregiver, self-efficacy, post-transplantation days, and rejection experience. Among the 4 readiness categories, personal status was the lowest and coping ability was the highest. This indicates that they are emotionally ready, but physical stability were insufficient. With subjective adherence results, no one responded to the non-adherence at dose level. Therefore, non-adherence patients mean that they didn't took medication at the prescribed time more once. Adherence were different at 1 month and 3 months according to their post-transplantation days and readmission experience. After 3 months, adherence were different whether the caregiver was spouse. In the CV adherence case, 1 month after spouse group were more likely to take medication properly. Also, adherence were significantly different according to the post-transplantation days after both 1 month and 3 months. As shown in Table 4, adherence showed the gap between 2 methods in 1 week. However, at the end of the 3 months, it became quite similar. Daily life self-care had decreased over time, but the changes of it were not statistically significant. At 1 week, self-care was high when they have a high self-efficacy and readiness. Also, recipients had a better self-care at 1 month when they experienced rejection before discharge. When the caregiver was a spouse, self-care was significantly high at 3 months. As a result of significance model tests for medication adherence using logistic regression, there were no effective variables. Table 6 shows that effective factors of self-care. The self-care became increased as much as 0.291 according to increasing readiness. At 3 months, when readiness score increased by 1 point, then the self-care behaviors had decreased by 0.16 were compared to 1 week. It meant that all behaviors will decrease after 3 months. Moreover, recipients who didn't experience rejection had a low level of self-care, as much as 7.066. These are the discussion of the study. Liver recipients had significantly high discharge readiness when their caregiver was their spouse. It is the similar result to several previous studies that the presence of spouse can be a key factor to increase self-care. Therefore, the healthcare providers need to include their caregivers in discharge education together. Also, high self-efficacy enables them to increase the level of readiness with physical and functional abilities and emotional stability. Most reason a prolonged hospital day might be the recipient's low recovery, complication, or acute rejection events after transplantation. Then we can guess it may affect their readiness. Previous research revealed that the surgical patients were found to have lower discharge readiness compared to medical patients, which means that their low personal status due to pain caused by operation affected to be ready. But this graph shows that adherence continuously decreased from 92% in 1 week to 58% in 3 months, whereas the CV group slightly increased after 1 month, but decreased at 3 months inversely. This difference between two methods tells us that the recipient's self-report can detect the actual early stage non-adherence. In former studies, CV value cannot be a gold standard due to the high variability in the early stage of transplantation because of the patient's clinical reasons and personal conditions. This is consistent with the recommendation for the former studies to use combinations of various scales to assess medication adherence. In this study, we realized about the 40% patients took medication at the wrong time. Tacrolimus is a drug that checks their lowest concentration immediately before administration. For that reason, it is the vital in terms of pharmacokinetic, not only taking the exact dose, but also keeping the time well. Before discharge, we need to put more emphasis on timely administration. A lot of studies are being attempted to improve adherence by alarming the administration time using application or text message. Moreover, researchers should consider when is the best administration time for them. Inevitably, there were limitations in this study as follows. The small number of subjects less than 100 for the linear mixed model or logistic regression has difficulty to derive significant predictors. Also, it is difficult to generalize to the whole liver recipients because the participants are discharged from only one organ transplantation center. Moreover, the endpoint of this study as 3 months was relatively short in predicting long-term self-care, even longitudinal study design. Therefore, to compensate those, it is recommended that the large number of recipients from multi-transplantation centers are needed for future study. Also, it would be desirable to derive predictors of self-care by checking longitudinally more than 3 months as a long-term point. To sum up, the degree of medication adherence after 3 months was found to be about 40%, which is still high. In this study, Readiness could not predict medication adherence. Also, it was confirmed that self-care had reduced over time regardless of their readiness level, but especially decreased significantly at 3 months compared to 1 week. In conclusion, healthcare providers are sure to assess medication adherence and self-care at the outpatient visit for 1 to 3 months with in-depth counseling and intervention. Thank you for listening.